Hey everybody, it's Dr. Hammerstedt from Holist. Welcome back. I'm pretty excited to have two Medical Mondays today. This morning we talked to Dr. Free Hess about the PD mom and child safety, and today we're going to be talking to Alisha Congress, Dr. Alisha Congress, about her pediatric specialty, which is that she is a passionate advocate for premature infants and their families. So Dr. Alisha Congress is a family medicine doc, author, speaker, blogger, mentor, and a mommy. She's got a great personal story about infant prematurity, and she's got a story to tell us. So welcome back for Medical Monday here today with Dr. Alisha Congress. And you guys know that I love doing these interviews with other docs because I think it's really important that we're able to share, each other's passions with a bigger audience. But also I think it's important that we start working together to break down these silos in between different types of specialties so that we understand a little bit more how we can work together and to advocate for each other as a physician community. And the bigger picture of Holist, of course, is that I love putting together teams of practitioners, physicians, but also other practitioners to work in teams around specific health and wellness goals. And that's what Holist does with our weight program and upcoming women's health and our upcoming fitness program. And here is Dr. Congress. Hi there.
Hi. Can you
Hi.
hear me okay?
I can. It's perfect.
Good.
And we have watching here Dr. Hess. I just had a interview with her this morning about pediatrics as well. So thanks for watching.
Oh, cool. Hi, Dr. Hess.
So I was introducing you a little bit. Family medicine doc, author, speaker, blogger, mommy, mentor. You've got a whole bunch of hats you're wearing, just like a lot of us do.
Absolutely.
Tell us a little bit about your practice and what you do, and then we'll get into miracles and milestones and talk about your story and what you're an expert at.
Absolutely. So as you mentioned, I'm a board certified family medicine physician. I guess that's what I do by day. I actually practice at the hospital at which I was born, which is full circle for me, and I feel incredibly blessed to be able to do that. The hospital where my grandmother cleaned the doctor's lounge is surreal for me to be able to walk in my calling there.
Yeah.
And to see so many people who even knew her, who knew her then, who worked with her then, some who have become my patients. So it's just, it's mind-blowing.
Yeah, that's
It is mind-blowing.
I love that.
Yes.
So what do you love about family medicine?
Oh my gosh. Family medicine is the perfect smorgasbord of medicine. I get to see so many different things, and I love that I have that variety. I love that no day is really like the previous one or like the next. You don't know what you're going to get. I get to see everyone. We call it cradle to the grave because I'm blessed to have that experience. I have some families for which I'm taking care of 3 and 4 generations of that family, and I love that.
Yeah.
I love being able to do that. I love that I have the opportunity to teach as I'm practicing medicine. I'm also allowed to teach and help people to take care of themselves better. And it's also a forever learning experience.
Yeah.
Just as an aside, you'll hear Langston in the background. Langston, when I agreed to this, I didn't realize it was Labor Day and that I would be at home. So I said, I'll just do it right after work before I pick him up. So now he's angry. I wish you could see his face. He's got both eyes because he's not pleased with me. But yes, this is my full work-life balance. I may have to go hand him a cracker here in just a second.
Yeah, that's okay. He can join you too if you want. But so before we talk a little bit about Langston and how that really brings you into your expertise on parenting premature children and going through that journey, you're talking about sort of the breadth of people that you get to care for in family medicine. And I'm an emergency medicine doc, and I sort of think about them sort of being two of the same coin. You know, it's like,
oh yes,
I see cradle to grave. I see them in a much different context than you. I don't have that longitudinal involvement with them,
right.
but I love both of those specialties for that reason, is that we really get to serve everyone at all parts of their life. So
Absolutely, absolutely. And it's so rewarding to be able to do that.
Yeah. So tell us about Miracles and Milestones, and how you and Langston are on this journey together.
Oh my goodness. So Miracles and Milestones is my day and night job. It's my passion. It's what I realized in our journey. As when I went into labor with Langston, I was 22 weeks, 6 days gestation. And
just so everyone knows, you're aiming for 40 for people who aren't
yes,
in the medical field.
Yes, just barely over halfway there.
Yeah.
And it was, I was told I had a bulging bag of water. So at that point, I'd never felt so hopeless at that point, because, just in knowing what I knew, I'm like, what are we going to do at this point? So
it's almost
anyway,
right?
It was terrifying, but during that time, I remember questioning why. I'm like, I did what I was supposed to do. I followed the directions. I stopped coffee literally the morning after a positive pregnancy test. I was following the rules, and I just was so distraught and so frustrated in why is this happening. And as our process went on, I figured out why it was happening. It was happening because I had to go through that to get here. I had to have that part of the test for our testimony, and for who we are and where we are now, and to be able to act as a support, as a mentor, as an inspiration for those who are going through the same thing that we are. So it's been so rewarding for me just to be able to be a sounding board for those moms. I've had so many from all over the world, even, which blows my mind, as this, girl from Hueytown, Alabama, that I've got people from other countries that are inboxing me and saying, I've seen your story. I just had a baby 2 days ago, at 23 weeks. I know what we're up against, but seeing Langston and seeing your story and how you've handled it has helped me to breathe a little bit. It gives me some hope. And that's what I want to do. That's our goal, is to be able to mentor, to provide education, to provide support, and in the long run, to provide some bit of hope.
Yeah.
Having a child prematurely is not something that you can prepare yourself for at all. It's just not. And everything was good until it wasn't. That's just the God's honest truth. And I went to work and everything was fine. And then all of a sudden, I was in the hospital. And there was no warning, there was nothing. So I'm a very type A person. I'm a checklist person. There are check boxes. If I do things that are not on my checklist, they get written on my checklist so I can check them off. So I'm that person. So this was one of those experiences for me that was like,
yeah,
what? I don't deal with this type of stuff well. But I know that there was a purpose in it, and every day I'm learning more and more about what that purpose is.
Yeah, that's great. So I can imagine it's a pretty unique perspective to be a doctor in that situation as well. And maybe first put your doctor hat on a little bit and talk to us a little bit about what are the risks of prematurity and what are those expected courses and outcomes, and then we'll talk a little bit more about tips for parents, kind of logistically.
Okay, so I would, first of all, I don't want to ever try to feel like I can cross over into the neonatology realm. Right. My sister Terry is on here. That's her thing, and she is a boss in that field. But I know that some risk, which is one risk factor that I did have, was being overweight, and that was one of the ones I blamed myself so much for, and saying, wonder if that was it, because there was nothing else I could do. There was, of course, not eating as you should, too much caffeine, Stress, of course, it can be a factor in anything. Why our mental health is so incredibly important. What are some other things? Smoking, of course, is just seems to be a risk factor for everything.
Yeah.
So of course, you have so many different reasons, and sometimes we never find out what causes you to have a child prematurely. Anything from having chronic conditions, blood pressure, diabetes, all of those things, neither of which that I had. So I felt pretty good, about things. But what caused me to go into labor, what we later found out was an incompetent cervix, and I started to dilate early. And we haven't really been able to.
I always hated that term. Why do they call it incontinent? I think
actually I think the new term actually is insufficient cervix. Okay. Well, so it didn't quite do what it was supposed to do, but it could. I don't know. I don't know. So that was my reasoning for dilating early. And like I said, I had no signs. I had no idea that this was happening until I went, that morning, and I started to have symptoms and went to the hospital. So it's one of those things why prenatal care is so incredibly important, and why that's such a passion of mine too, in making sure, there's so many healthcare disparities. Yes. Dr. Gordon is on too. She just said family history of collagen disorders. Yes, that's a huge one. She's OBGYN extraordinaire. She knows this stuff, and for me, that was what the cause was. And, I've already been told that if there are any subsequent pregnancies, which we're not planning on subsequent pregnancies, but if there are, that I would be required to likely have a cerclage and, some bed rest and things like that, just looking ahead as possibilities.
A cerclage is literally like sort of like a knot that they tie kind of to tie up that incompetent cervix.
I do have to say, though, that during this experience, I've had 2 fellow micro-preemie moms who have delivered since Langston, and we delivered around the same time. They've delivered since Langston and delivered term babies. So, there is hope for that. I just don't know if that's something I'm wanting to deal with right now,
Well, so because you touched on weight, and I'm a lifestyle medicine physician as well, and weight wellness is a big training program that Holis does, and I just want to touch base on that just real briefly, because I heard you talking about blame with that, and I always want to remind people that weight is a completely hormonal issue, and it is not a lack of willpower. It is not anybody's fault. And it actually is quite, once you get into the metabolics of the hormones and how your body works, is totally doable. So if anyone wants to reach out for me about information about that program, I'm happy to talk about that. But I wanted to address kind of the blame, which I think we all do to ourselves. So I wanted to move on from that. So
I'm definitely glad I've worked through that. That was a initial feeling, but I'm grateful that I didn't beat myself up too much with that.
Yeah, totally good. So tell us a little bit about kind of what a parent should expect initially in the NICU, and kind of through that process, and kind of give some tips to this parent, who might be watching, who goes through this in a couple months or something like that and remembers this. What are some practical tips or some emotional tips that you can give from your unique perspective?
So what can a parent expect? You can expect an emotional roller coaster. That's what you can expect. The NICU is indeed a roller coaster. It changes from minute to minute. I mean, sometimes second to second. There is expect to need to change, to learn to adapt quickly. Expect to be able to step outside yourself and to allow help. I was that person that I don't ask for help. I just don't.
Yeah.
I'm terrible at that. I'm terrible at asking for help. I'm terrible at asking for anything, honestly.
I think a lot of us doctors are that way.
and that's a problem. You have to learn to ask for and to receive help, because you're gonna need it. You're gonna need it. there's so many things you prepare you can't prepare yourself for it. But some of the things I would say, there will be guilt. You'll wonder what you did wrong and what you could have done differently. And you look at your baby there, and you trade places with them in any second. Mm-hmm. And it's an emotional roller coaster. You don't know how to feel at some points. I remember in the beginning, I would try to visit him, but the anxiety was so bad. I knew what all of those numbers meant on the monitors. I knew what the alarms meant. I knew what the labs meant. I knew what the statistics said. And I remember praying that God would take that stuff out of my mind, because I just wanted to be his mommy. That's all I wanted to be. Mm-hmm. And I was saying, I cannot, please don't, I don't want to be a doctor right now, is what I remember feeling. So you're going to be scared. And I can imagine with the person, even in not having the medical background, there's so much going on around you. And I remember Langston's father he didn't know how to take it. I mean, he had never seen a baby that small. Langston was 1 pound, 7 ounces.
Oh my God, amazing.
He fit just in your hand here. And he was 12.5 inches long. And there he was in this little box, and he was hooked to all these wires and tubes, and things were beeping, and he didn't know what to think about it. And nor did I. I would also say, as what I've been preaching all along is, don't be afraid to speak up. Talk to your doctors and nurses. Be there whenever you can. When you need to walk away, walk away. You have to still be human. Take the time to eat. Take the time to take a nap. Like, you have to do that. As Camille and Terry said, you have to make sure that you speak to the doctors and nurses to have them to let you be the parent. I wish I could show you this picture. I may post it in the post later, of Langston was just a few days old, and I said, I want to help. I wanted to check his temperature. I checked his temperature. I changed his diaper. His little bottom fit between my fingers like this. And it was the weirdest thing, but I wanted to change his diaper. I wanted to push his tube feeds. I asked them, I said, what can I legally do for him? Mm-hmm. Whatever I could legally do, I did. When we got up to bath time, I'll remember, oh my gosh, I had one day I told them, I bathe him. Period. Do not bathe my baby. And I came in one evening from work, and the nurse had bathed him. I had a complete come apart. Yeah. Because it's hard as a NICU mom to feel like the mom. Yeah. It's hard. And I'm like, you're taking all I have. I could give baths. Don't take that away. To
create that connection through all of that artificialness. Yeah. There's
absolutely.
That's such an important thing for both of you.
Yes. Yeah. Yes. It's so those are just some of the main things that I would say is extend yourself some grace in saying that you can't do everything. Mm-hmm. And so many of us have that superwoman mentality where we want to do everything. We think we can do everything. I went back to work when Langston was 2 weeks old, because my goal was to make sure that I could stay home with him when he came home. My heart wouldn't allow me to think of if he came home. I had to say when he came home.
Oh, well, I didn't even think about that logistical part, right? Wow, back to work at 2 weeks.
2 weeks, I was back at work, and that meant back to work. I was nursing, well, at that time, of course, he couldn't nurse, but pumping. So my routine was, get up, pump, call the hospital, get ready for work, pump, work, pump, work, pump. Did I say pump?
Yeah, that sounds like a lot of my years as well.
And then when I get off work, you go to the hospital.
That pump, I tell you, is ingrained.
Yeah. Oh my gosh, it was attached to me everywhere I went. I felt like, and even my nurse would say, "Hey, it's time to pump." I had alarms. It's time to pump. It was. And then you get off and you rush to the hospital and you stay there for hours, 9, 10 o'clock at night, because you want to be there. You can't be there for morning rounds. So you want to be there for nighttime rounds, which is 9 p.m. And you want to be able to talk to the doctors and ask the questions that you want to ask. And that's one of the things that Miracles and Milestones has been trying to work with the local NICUs with, and seeing how we can partner to help those parents who are working parents. because there's so much going on during the day. They have programs with cross stitching and massages and, you know, scrapbooking and all this stuff. And I'm like, I'm at work.
Yeah.
I can't scrapbook. But we're trying to create programs in the evenings to decompress and also be able to talk to the staff and, you know, at least a couple of days a week that's available.
Yeah.
But it was for me was just trying to, I felt so overwhelmed, but I didn't know how to ask for help. And I felt like there was nobody to help. Like, who's going to do it? Nobody can pump for me.
Right.
You know, so
how long were you guys in the NICU, and when did they decide that these babies can go home?
Oh my goodness. So we were there 152 days. Langston was what they called a feeder grower. So his thing was he had to get bigger. Mm-hmm. And there was no set weights that he had to reach. He just needed to consistently be able to hold his temperatures, and he needed to be able to, you know, gain weight appropriately and not drop his weight, you know, hold his heart rate, you know, all of those things were what we had to have take place before we could go home. He did go home on oxygen. It was our goal that he didn't, but at that point it was like, I just want to go home. I just want to take my baby home.
Right. Yeah.
Yeah.
How are those first? I can imagine, you know, it's always hard to have a newborn at home when you have never had a newborn before, but the transition from having people do everything for him to suddenly having him at home, plus having all the worries of, you know, prematurity, that must have been really hard. What tips do you have for our watchers about kind of what to expect during that experience?
Expect to be scared out of your mind, no matter what your background. You know, I'm like, I do this for a living, you know, and he was pretty stable at that point. You know, I had gotten into the point, the mindset of, with the nurses, I'm like, just let me do what I'm doing. You know, they would come in to do what they had to do. But beyond that, I was adamant about, this is me and Langston. You know, let me manage as much as I can, doing the suctioning, doing the temperatures, you know, checking all of these things. That was what I had to make happen in order to make sure that I was prepared when it was time to go home. Mm-hmm. So getting home, I remember everybody was here. He had this, you know, this homecoming and everybody was here, and then they left. And I was like,
well, you're all leaving me
wait a minute. Who said it was okay for me to have this child here by myself? And so it was quite the harrowing experience, but we had the monitors, you know, I had my monitor, I had my pulse ox. I'm like, okay, you can do this. But you have all this equipment, you've got the oxygen, and you've got Langston, he's trying to get used to this new place. There's new smells, new sounds, not enough sounds. You know, he's used to being in the NICU.
Your friends are chiming in that he hated his oxygen too.
Oh gosh. Oh, we fought with that oxygen. Oh my gosh. So many mornings we woke up and Langston's oxygen was here.
Yeah.
Or here. Yeah. Or on the bed next to him when he figured out how to take it off.
Yeah. Yeah.
That was the experience. He knew, but this is the same child who self-extubated 3 times.
Yeah, right.
He was just adamant that he was going to do what he was going to do. And that last time they finally said, well, let's just see what he does. And here he is. He never went back on the ventilator. He extubated himself, and that was it.
My guess is he's still adamant about a lot of things.
Oh, that's an understatement. Yeah. That is an understatement. He runs this house.
And
please
so
know.
He's 2, right?
He is.
He's 2. That's great. So tell us a little bit about, you know, we heard a little bit you're planning some programs with the NICUs around you for your company, but you also have a book, and it sounds like you're, you know, blogging and communicating with people around the world about this. And what's your goal for your company, and what are you hoping, and how can we find you?
Okay, so what we're doing right now is I've been talking with some people at UAB Hospital where Langston was born, talking with the NICU liaison, We have some things in the works, trying to create some programs for the after work time, for the after work crowd. I've also been talking with March of Dimes. I'm on a couple of committees here with March of Dimes, and we were actually a March of Dimes ambassador family last year, and they've been excellent with sitting down and talking with me and seeing what can we do and how can we help these families. So we have so many things in the works. I'm really excited about where that is going, and that they share the same passion that I did. Once I talked to them about it, they're like, oh my gosh, like that's not just at UAB, but this needs to happen in a much wider scale. And I'm super excited about that. Super excited.
That's great.
I have written a book. My book is called Miracles and Milestones, and it chronicles our experience, the NICU experience, and it's written from my heart. So much of the book is the things I was afraid to say out loud at times. Allowing myself to be vulnerable to how I felt and what I needed, and rethinking those things. I did some journaling while he was pregnant and while I was pregnant, and while he was in the NICU. But I wrote my book after the fact, and it was such a surreal experience reliving some of those moments. There were some tears, there was laughter, there was heartwarming moments where I looked at my, looking at pictures as I was choosing them for the book. And I'm like, oh my gosh, I remember this moment. I remember taking this picture. I remember everything about this moment and reliving that. So that's what Miracles and Milestones is. It talks about our journey and getting to the home front, making it home, and that dream that I had so many times of leaving that NICU and never coming back, at least not as a patient. We've been back to visit, and it's a good feeling to do that. I'm grateful that we still have a relationship with so many of our nurses, that they're friends with me on Facebook, and they follow along with Langston, and they're making sure how he's doing and what he's doing, and they poured into him so much. And the neonatologists who allowed me to be his mom, but also respected me as a physician. That was something that you really, I can't put into words how much that meant to have them willing to do that, to trust me when I say, well, look, he doesn't look right today. Something is going on. And those doctors would say, look, I trust you as his mom. I trust you as a clinician, and we're going to look into it. And that mother's intuition is something serious. I tell you, it's something to behold. But yes, I have been blogging, and we've been doing that now for about a year, and did wonderfully. I mean, all over the first week we had over 10,000 hits to the blog, and from all over the world. And I just my mind was blown. My website designer, she called and was like, what in the world is going on here? And I'm like, what's going on here is exactly what God ordained to go on here. Was that we were going to reach the masses. We were going to reach the masses and help those who needed to be helped. Our blog is actually at www.miraclesandmilestones2016.com. And you can learn of all of Langston's shenanigans. We do a mixture of funny and informational. And I'm not a person who's able to be serious for too long. So we have to have a mixture for me to function.
That's great. Please drop those into the comments when we're done too.
Absolutely.
So that we can do that. And then also a separate comment on how to get directly to your book, so we can remove the inertia for people getting right to it.
Oh yeah. Yes, I'll definitely do that.
Yeah, so it's really great to talk to you, and thank you so much for taking your time out on this day. And Langston did a great job over there frowning at you.
He did. I'm so proud of him.
Yeah.
He just kind of looked away like, whatever.
Do you want to invite him over so you can wave at us real quick?
I have him in the high chair because he couldn't be free
while
this was happening.
Oh,
hold on one second. I'll actually try not to get my house that has been ransacked by him in the background. Hold on one second. Let's see if I can get him on here. He looks like a wild man. I'm sorry. He's not TV ready or interview ready today.
It's all right.
You want to say hi, Langston?
Hey,
you don't want to say hi?
Hi.
Langston. Look.
We just heard all about you. He's having none of it. Adamant about having none of it. Well, thank you so much.
Typical.
Alisha. It was
That's really typical Langston Miles.
Yeah, exactly.
Great talking to you too.
All right, take care. Bye-bye.